Are you struggling with a L4, L5, L5-S1 disc bulge? Do you feel like you've done everything under the sun to get this treated, yet you're still dealing with it? Decompression therapy might be exactly what you need. Stay tuned in this video and I'll tell you everything you need to know about it. In today's video, I'm going to go over decompression therapy, an awesome technique that we use in the office for treating L4, L5, L5-S1 disc bulges. We're going to go over what it is, how it works, what a typical care plan looks like, and how it might get you results. We'll also talk about whether or not you might be a good candidate for this therapy. Hi, I'm Dr. Daniel Bridge. I'm a chiropractor here in Helena, Montana, and this channel is dedicated to teaching you tips and strategies to taking care of your spinal health so that you can lead a healthy, pain-free lifestyle. Today specifically, we're going to be talking about the L4, L5 disc and the L5-S1 disc. That space between those vertebrae is where we see a lot of disc bulging and disc herniation due to the large load that our lower back holds, as well as the ranges of motion that we put it through lifting and just through our activities of daily living. Decompression therapy, however, is a very effective treatment strategy, and it might be exactly what you've been looking for. One of the common questions I get surrounding a low back disc bulge is, can I heal from this? And oftentimes the answer is yes. Like I just mentioned, the L4, L5 disc right here and the L5-S1 disc right here, those are the two most common discs to herniate and to bulge. If you look at the whole spinal column, that's where all the weight is being supported, right down low. That's a lot of weight, it's a lot of pressure. And with unhealthy lifting or a traumatic accident, it can cause those discs to move outside their regular area, putting pressure on those nerves, causing sciatica, where you're going to get pain, numbness, tingling, or weakness down one or both legs. They become under such pressure that it causes those discs to bulge out. Decompression therapy, on the other hand, is a great way to reverse that. What that does is it provides a very gentle, firm traction, decompression here on the lower vertebrae in your back, causing them to expand, to create a negative pressure which can suck in those disc bulges and disc herniations, and it can actually increase the disc height, taking pressure off those nerves and allowing that area to heal. Also, another mechanism that is effective for a disc, it increases the nutrient and the fluid exchange into those discs. It's a big word called imbibition, but essentially what that means is our discs have very poor blood supply. So they get their nutrition through us moving around, pumping nutrients in and out of that disc. But if you have a disc that's under a lot of pressure, or you have a segment in your lower back that's locked up, that's going to prevent those discs from getting that imbibition. And so what a decompression table does, as I mentioned, is it pulls and it stretches, but it differs from a traction table because it also relaxes. So it creates that pumping effect in the disc. Traditional traction tables have been shown to actually, that sustained pull on the muscles can cause them to tighten up and to even spasm, whereas the decompression with the pull and the relaxation, it actually keeps those muscles very relaxed, while once again, pumping good nutrition in and out of the disc. Hello, I'm here with child actress Jade, who just so happens to be my daughter, but the price was right, so I was able to hire her for this video. We're going to demonstrate what decompression therapy looks like. Although you would never do it on a child, most of my patients are over the age of 18. Sometimes if someone's 16 and they're more developed, you can use decompression therapy, but usually it's 18 or older. But just for the demonstration purposes, Jade, will you go ahead and lay down? I have to adjust the belt to make it fit her, since normally, like I said, I'm working with adults. But the belt goes around their waist. And this is the motor. This is what powers the table. So we clip it all in. And what this is going to do, the table goes up and down, but I had it in the up position just for the demonstration. But as this pulls, it's going to pull and decompress the lower back or the lumbar spine. This table has a hinged piece in it so that as the motor engages, This piece is going to slide backwards. This piece is going to stay stationary, and it looks like this. And that's what allows us to decompress. Now, it's going to decompress, and then it's going to relax. And it's going to do that, hold for 30 seconds, and then relax over and over again for however long I set the timer for. Usually the treatments are between 12 and 20 minutes. Also on the machine, I get to decide how strong I want that pull to be. Usually we start lower and we work our way up based on patient need and patient tolerance. Treatment plans can be anywhere from 12 visits to 24 visits dealing with a disc bulge in the lower back. They do really well with this therapy. Now, you might be wondering, am I a candidate for decompression therapy? Some of the questions you need to look at is, where is your pain? Is your pain in your thigh? Is it going down into your calf, into your leg? Once again, are you dealing with numbness, tingling, weakness, burning? If so, you could very well be a candidate for decompression therapy. One thing that you really want to look out for is if you're having numbness and tingling on the inside of your legs, the skin that would sit on a saddle, that's called saddle paresthesia, and it could be a sign of something called cauda equina syndrome. That should be a trip to the emergency room. But if you're having the standard pain going down the leg, you might really be a candidate. Of course, you need to see your nearest chiropractor who specializes in decompression therapy, and they're going to be able to go over their tests and consultation to really give you a good idea as to whether or not they felt like this therapy could be effective for you. There are contraindications for decompression therapy. We don't do it on pregnant women. We don't do it on somebody that has an infection in their disc or in their bones. If you've recently had a surgery, if you've recently had a fracture that hasn't healed, those are all reasons why you should not get decompression therapy. Thank you for tuning in to today's video. If you have any questions about L4-L5, L5-S1 disc bulges or decompression therapy in general, please leave them in the comments. I'll be sure to get to every single comment. Also, please like this video, subscribe to our channel, and share if you think this could benefit a friend or family member.